So, joining me today to give answers to this question is a consultant in oral medicine from the great Obafemi Awolowo University Teaching Hospital, Ile-Ife, the ever-charming Dr. Adewale Adedotun. Dr. Adedotun, welcome to today's show.
Thank you very much. Thank you for having me, Dr. Moni.
You're welcome. Yeah, thank you very much for joining us today. So, please introduce to the people of Naija what oral medicine is all about in a nutshell.
Well, oral medicine is a specialty of dentistry that is strongly emerging in Nigeria at the moment. And it is a specialty that is concerned with the oral health care of individuals with systemic diseases like diabetes, hypertension, blood diseases, and so on. It also involves the diagnosis and non-surgical management of medically related disorders or conditions affecting the mouth, that's the oral cavity, and the facial region. These conditions include oral mucosal diseases, oral manifestation of systemic conditions like the ones I mentioned earlier, and the oral effects of medical treatments. In addition, oral medicine practitioners have special expertise in the management of neuropathic pain conditions. These are pain conditions that are not related to the tooth or the supporting structures of tooth. They are as a result of problems with the nerve supplies of the face. It is also important to note that the mouth mirrors the body. In other words, there are systemic diseases that have oral manifestation, and the diagnosis and management of the oral manifestation of systemic diseases is also an important aspect of oral medicine. So oral medicine comes to the fore in the understanding of the link between oral and systemic health.
Okay, thank you very much. So I noticed these days that people complain that they perceive an unpleasant smell while wearing their face masks. Personally, I believe the face mask does not make us have bad breath, but rather it actually makes us more conscious of the fact that we may actually have a bad breath. So as a specialist in this area, Dr. Adewale,
bad breath is also known as halitosis. So during the course of this podcast, it permits me to use both terms interchangeably.
Okay.
Bad breath also means halitosis. And simply, it is an offensive, unpleasant odor that is emanating or coming out from the mouth or the oral cavity. I will also say that approximately 90% of all bad breath originates from the mouth itself, and about 10% emanates from elsewhere, either from the respiratory tract, the gastrointestinal tract, from diseases like uncontrolled diabetes mellitus, kidney failure, liver disease, and so on. Also, bad breath can be classified broadly into two. That's the true bad breath or true halitosis and the false halitosis. Yes, the true halitosis can be transient or temporary, and there are also true halitosis that are pathologic, that is, they are as a result of underlying systemic diseases. And there is also false halitosis, that is, the halitosis is not there, but the individual feels he or she is having a bad breath.
Yeah, not real. Okay, thank you very much. I'm sure my listeners too will like to know the possible causes of bad breath.
The origin of bad breath, let me explain that.
On this.
The principal thing is that there are bacteria in the mouth. They are called anaerobic bacteria. They are bacteria that can survive in the absence of oxygen, and there are quite a number of them in the mouth. So the oral cavity provides a conducive
Okay.
milieu for them to thrive. So this anaerobic bacteria kind of feed on food debris and shed epithelial lining. These epithelial linings are like the covering of the oral cavity or the mouth. So from time to time, they are shed. So this anaerobic bacteria acts on them to produce what is called volatile sulfur compounds. And these volatile sulfur compounds are what is responsible for the breath that is perceived. And these sulfur compounds include hydrogen sulfide, dimethyl sulfide, and methyl mercaptan. Also, the anaerobic bacteria can also act on sulfur-containing amino acid to produce this volatile sulfur compound. So it is this volatile sulfur compound that is perceived actually as bad breath. Now, should I go on to talk about the causes? Okay. So the causes can generally be divided into two.
We'll be grateful.
Intraoral causes, those are causes that are emanating from the mouth itself. And there are extraoral causes, those are causes that are elsewhere from the mouth. So for the intraoral causes, one important factor is saliva. So saliva, amongst many other functions, acts as this cleansing ability. That is, it removes bacteria and food debris from the mouth. So continuous flow of saliva in the mouth has a cleansing ability. So in a situation where there is a reduction in the flow rate of saliva, this cleansing action is lost, and that can result in bad breath. That is, if the mouth is dry, that's when there is reduced saliva flow. Also, saliva has this antibacterial activity. So in a situation where the flow rate drops to, this function is lost. So the anaerobic bacteria I talked about earlier have a field day to thrive in the oral cavity. So that can also result in bad breath. And also the pH of saliva is slightly acidic. So this acidic nature of saliva kind of deactivates the action of some of these proteolytic anaerobic bacteria I talked about. So also, when there is a reduced flow rate of saliva, this action of saliva is also affected. So reduced saliva flow rate for dry mouth is one important intraoral factor.
Yes.
The second one is gingivitis or periodontitis. That is when the gum is swollen or the body structure of the teeth is inflamed. So there are spaces between the teeth and the gum naturally, and this acts as entrapment of food for people with swollen gum or for people with periodontitis. And eventually, bacteria act on these entrapped food substances, producing odoriferous substances. Also, a gum that is swollen has bleeding tendencies, and this makes the condition worse. Initially, it will impact this ionic or metallic taste in the mouth, and later, as the blood decomposes, a more foul smell is produced. So that's another factor. Then the third one I would like to... Go ahead, please.
Before you go, can I quickly ask a question? Can you just tell us the conditions that could cause reduced saliva flow in the mouth, and the conditions?
Yes, the conditions that can cause reduced saliva flow in the mouth. There are quite a number of them. The ones that are common, it can be drug induced. There are over 500 drugs that are used routinely to manage systemic diseases that can cause a reduction in saliva flow. Okay. Then there are also diseases directly affecting the salivary glands. These are the glands that produce saliva in the mouth. Diseases that affect them can also result in a reduction in saliva production. Also, chemotherapy, radiotherapy, and so on. So there are quite a number of factors that can result in salivary flow rate. Then for gingivitis and periodontitis, what is primarily responsible for it most of the time is poor oral hygiene. That is the primary factor. Then the third thing I was going to talk about was coated tongue. As one of the intraoral causes for bad breath. So a normal tongue is not smooth. It has what is called the papillae. It also has crevices. Also, this confers like a rough surface on the dorsum of the tongue. So these surfaces also, as because it is not smooth, there can be accumulation of bacteria and food debris on the surface. So if from time to time it is not cleaned properly, it could be responsible for bad breath. Then lastly, for intraoral causes, tooth deposits, tooth with large holes or cavities dental caries can accumulate food debris to which, if it is not taken care of on time, the food debris accumulating there will decompose and can result in bad breath. The external causes are some of the systemic diseases that I talked about earlier: uncontrolled diabetes mellitus, kidney diseases, liver diseases, and diseases affecting the respiratory tract.
Okay, thank you very much. I'm about to ask this question that I'm sure will be bothering people experiencing this bad breath under face masks.
Yeah, thank you.
Like, what's the connection between
the first thing to note here is that
the
face mask is not the cause of the bad breath. So it is possible that the individual has poor hygiene before using the face mask. So the face mask is just increasing the consciousness of the bad breath. And the reason is because wearing a face mask is compulsory now. So exhaling into a covering such that the hair that is being breathed out hovers around the nose all the time because of the covering of the face mask. That is what is increasing the consciousness of the individual to the bad breath. Also, it is important to note that people wearing face masks, from time to time, you talk with the face mask on. So there is the possibility of saliva being deposited on the face mask from time to time. Also, sweat from the face is also deposited on the face mask from time to time. So all this can actually worsen the smell that is perceived from time to time when the face mask is done. But the critical thing here is that wearing face mask with poor hygiene will increase consciousness of bad breath. So it's not actually the face mask that is causing it, it is the poor hygiene that is responsible.
Okay. So what can we do as an individual at home to check or confirm if we actually have a bad breath? If we have
simple
bad
things
breath,
that can be done. There is this dental floss that is used to pick food substances in between the teeth. So if you can try to just apply the floss in between the teeth, remove it and try to smell it. For people with poor hygiene, even if after brushing the teeth, that kind of odor that you perceive from the floss will persist. But if your oral hygiene is good, the moment you brush, you should not perceive that odor. Yes, so that's one thing that can be done. The other thing that can be done is the hand can be cupped, like a covering of the hand over the mouth, and you now breathe out and you try to smell the hair that is exhaled. That's another thing that can be done. The third thing that can be done, one can ask one's spouse or partner to smell one's breath. Yeah, so that can be done. Also, the last thing that can be done is the use of plastic bags, air bags. Yeah, one can just blow hair into a plastic bag, and after a while, seal the plastic bag. then try to release the exhaled air and try to sniff it if it smells. So those are just a few things that can be done to check at home. But I must point out here that it is expedient to have a check done by a specialist, by an oral physician. That is very, very expedient.
Yes, that's very important. Okay, thank you very much. So, what are the remedies to bad breath? What are the things we should do?
Thank you very much. The steps that can be taken, I'll group them into two major things. General measures that can be taken and specific measures that can be taken. I'll first talk about the general measures that can be taken. The general measures, the first and the most important thing is basic oral hygiene. So basic oral hygiene entails that we should make sure at least we brush our mouth twice daily with medium textured toothbrush and fluoride containing toothpaste. Yes, at least twice daily. That is very, very important. And in doing that, the surface of the tongue too should be brushed as thoroughly as possible, because initially I mentioned tongue coating as a cause for bad breath. So the dorsum of the tongue too should be brushed thoroughly. Then the second thing that should be done, especially in this environment, is that we should ensure that we drink plenty of water and rinse our mouth thoroughly after every meal. Then I also like to encourage people out there to at least periodically visit their dentist for professional tooth cleaning at least twice a year. That's every 6 months, yes, at least that will help.
Yes.
Then regular flossing after eating also is also advisable. So those are the general measures that can be taken to combat bad breath. Then going to the specific measures now. The specific measures will entail if there are any causes that has been picked either by the individual or a dentist, they should be addressed. An example is probably if there is a carious tooth that needs to be restored, that has a hole on it that is stagnating food debris. It needs to be taken care of, and if it is irredeemable, it has to be extracted. Then periodontal diseases, gingivitis that I talked about earlier too, should be addressed. So if there are possible factors in the mouth that has been identified, or systemic factors that have been identified, they should be addressed. So that's the first thing for the specific measures. Then also the use of mouth rinse also helps a lot. But I must point out here that the mouth rinse should be alcohol free. Yes, the reason is that mouth rinses containing alcohol should be avoided because the alcohol will dry up the oral mucosa, the mouth. So it worsens the bad breath. So whichever brand of mouth rinse that we want to use should be alcohol free. Yes. Then also the bad breath can be masked by the use of mints, breath fresheners, especially the ones containing menthol. So that's like a temporary measure.
That would be like temporary measure.
The control of bad breath. Then I must also point out here that the face masks that we use from time to time, they should be washed at least daily. At least that will address the reusable one. Yes, especially the cloth face masks. The reusable ones should be washed from time to time, daily preferably. So these are some of the measures that can help in addressing bad breath. Then also if it's concerning, if it's giving the individual concern, it's also good that the person should seek the advice or the opinion of an oral physician. So the oral physician will do a thorough examination of the mouth and see if there are any causes that can be identified in the mouth, and the physician will offer advice on what to do from time to time.
Okay. Thank you very much. Lastly, I want to ask again, when and how should we contact the dentist with this COVID-19 pandemic? Most people are worried about exposing themselves unnecessarily to all sorts of things. So it's important for us to let our listeners know what they can do, how and when.
Yes,
they
I will.
can
The answer to that question is they can as soon as it is safe enough to visit the dentist. Ideally, the recommendation out there is that the patient visiting the dentist should have a recent COVID-19 test, and the doctor too should have a recent one. But in this climate, that is not possible.
Okay.
So there is nothing we can do about that. So the thing that can be done is probably when it's safe enough, when things get better, one can visit the dentist. Yeah.
But my own suggestion again is that with this advent of digital communication, you can find a way to
teleconferencing. Yes, that can be done. That can be done. But the thing is, it is difficult to do clinical examination of the doctors via video conferencing. So it has its limitations. That's the point I'm making. It can help. It can help for counseling and reassurance.
It does.
But when it comes to thorough examination, it can be done via video conferencing.
But can I ask you this question? Is it possible to
get an appointment
via this means? For maybe the real oral treatment, if we are all running away from aerosols and all that, all these I know dentists are running away from aerosols, but there are some things you can put in place.
Yes, definitely there are.
To control
in our own practice
spread
now,
of infection.
There's nothing like ultrasonic scaling. There's nothing like we can't do ultrasonic scaling and polishing because of the fear of aerosols.
Yes.
And the other things to do is, PPEs are not readily available out there. That's another challenge. So aerosol generating procedures can't be done at the moment. So the best we can do now is probably just wear face shields to do oral examination if it is an emergency. But that's what we do now. Just protect yourself with a face shield if it's an emergency case, and so that's what we do. But for bad breath, I do not think it is an emergency. Yes, so it can wait till things get better. But some of the measures I explained earlier can be used by the patient at least to palliate the feeling till things get better and they can see an oral physician for better attention.
Okay. Thank you very much. Thank you very, very much, Dr. Adewale. So today we've learned that bad breath is that unpleasant smell that we expire. The guest for us today also told us about the possible causes of bad breath and the things we should do when we have bad breath. Since poor oral hygiene is the most common cause of bad breath, it is very, very important for us now to practice proper and effective oral hygiene habits. I want to say a big thank you to our guest today, Dr. Adewale. I really appreciate you today for joining us in this particular show. I appreciate. Thank you for the knowledge.
Thank you for having me, Dr. Moni.
To all our listeners, I appreciate you today. Thank you very much. Yeah, thank you very much. So thank you, listeners, for joining us in this week's episode on ToothTraffic9ja. I hope you enjoyed listening to us. Don't forget to stay safe.